Okay. So here we are with Donna Riopelle. Mrs. Riopelle, you're running and with your husband a medical practice which does a lot of preventive care, but also you guys have started to kind of realize the problems of people being overweight, people not having the right hormones and whatever it comes to. So you fix a lot of stuff in order to make people being more active and have a fresher, better lifestyle while they are alive. Tell me a little bit how you go about that. What is it you do in your practice which people can look forward to in really improving their lifestyle rather than just, when you have a cold, you want to get rid of it. Got that, obviously, and you do that. I know you do that in your practice. But what about, those people who say, what can I do so that at 60, 70, 80, I actually still can cruise around, take a vacation, and enjoy perhaps any and all foods which I now like. Tell me what you do there.
Well, first of all, we take a very comprehensive approach to our patients. We look at the causes of all disease and then try to individualize the treatment plans. And we use bioidentical hormones when it's warranted, and that in turn helps people age slower and have a better quality of life. So menopause or andropause, the change in the female and male in the 40s and 50s, it's not so hard on them. Then also with weight loss, we realize that it has many, many different causes, just not calories in and calories out. So we decided to combine it with a lot of preventative and natural treatments.
Wow. So I like the word, it's not all about calories in and calories out, because, I'm 59 myself here, and I do have a couple pounds too many. I keep saying I'm fine. My wife keeps saying, come on, get rid of it. But the point is, this calorie counting, I'm not saying it has no value, but I like that I like to hear that it's not all about calories in and calories out. So when you say bioidentical hormones, are you basically saying that there are some hormones in the body which you could be giving the body, which the body is losing? We all know that there are certain vitamins, minerals, whatever it might be, some hormones, obviously, they just seem to be disappearing as we get older due to whatever reasons, like the lung, the liver, kidney, or whatever it might be, the thyroid's not working anymore. And are you saying you can replace them, and by doing so, keep the body having those hormones the way he had it when he was young, or at least close to?
Right. Yeah, you're right. If we measure the hormones at the different times in your life, then we can replace what's needed and just replace it in a natural way, not giving you too much and not increasing your risk of other diseases like cancer or heart disease. So we're just kind of, in other words, optimizing your health.
Right, because it is important, obviously, not to get too much. I mean, we hear about the bodybuilders and other sports people who seem to be taking hormones, and it seems to be kind of working for them, legally or illegally, is beside the point now. However, most likely they take too much, so their gain down the road actually didn't do their body any good. They may have for a while had a head start, but down the road the body suffers because they simply, too much of anything apparently is simply never good, right?
Right, yeah, I agree.
Okay, good. Now, tell me, those bioidentical hormone replacements, for instance, are they usually injections? Are they usually pills and tablets? Are they eating specific foods? What are we? How you get them to the people?
Yeah, that's a good question. So they come in various forms, but estrogen, for example, it's not safe, according to all the studies in the last couple of years, to take it orally, so we use estrogen topically. But like testosterone, on the other hand, it is okay to give it by injection or topical, but not orally. And then progesterone is one hormone that if it is low in the body, we can use either topical or orally safely.
Wonderful. Okay. And are those treatments, we have heard about those type of treatments, and apparently it's only the Hollywood movie stars who can afford it due to the money. Is that still true or not really anymore?
No, that's not true. It may be true for some of the more selected hormones, like growth hormone, but for the majority of hormones in our body, like thyroid and testosterone, estrogen, progesterone, DHEA, they're all very affordable.
And they are. I mean, you probably just from what I can, from hearing and reading. I mean, you just mentioned a package of some very important hormones. Yet, people apparently are lacking them as they advance in age quite heavy. So you already mentioned most of what is really needed, right? Right. Great. Okay. And how does one go about finding out that one is short of those things? Of course, one of the first thing is, I know you do that, but what is involved there? Are we talking about a simple blood test, or are we talking about something else?
Well, different hormones are tested by different methods. So, for example, estrogen, you can test by saliva, urine, or blood. Other hormones, it depends on what hormone we're trying to test, whether it's better to test it in saliva, like cortisol, or whether urine or blood would be better.
Got it. Okay. But again, also those tests are not painful, take not very long, and they're not super expensive, and might even be covered by the insurance.
Yeah, that's true.
Okay. What about the treatment itself? Is it sometimes covered by insurance?
Sometimes it does. It depends on the insurance plan and the patient's like deductible and out of pocket, how much it would actually cost them. Sure.
It's difficult to say these days because there are more insurances than there is people out there. Mm-hmm. more different plans. Well, all right. Well, Mrs. Riopelle, very informative. Thanks for your candidness. I'm going to do, we're going to go and check maybe more specifically into some of the specific hormones and into the specific treatments which are available. But you gave us a very good picture, and I think it's something most of us should look forward to. Because after all, I think we're not so much after living to 100 or 120. We're more like the time we live, we want to not be bedridden. We don't want to be weak. We want to live a relatively decent life. We're not even after to be doing these things when we were 20, but we at least don't want to be feeling like 95 when we're 60, right?
Correct. Yeah.
I got it. Wonderful. Did I interrupt you? Sorry.
No, not at all. I was just going to say we don't have to grow old on the inside, even though our bodies, change on the outside. We can actually go through life in our older years with a lot of vitality and energy and maintaining our memory.
Right, and it is so nice. I mean, I have a fair amount of friends and acquaintances who are in the late 80s, early 90s, and they're driving cars and they're doing fine. And I also know a few people who cannot do that from the age of 60 and 70 on. And what a difference in their life, in everything, in the way they enjoy life. It's just so wonderful to see elder people. And I don't know what they did to be that way. It doesn't really matter. The point is, you can help them to perhaps be like that, right?
Right.
Thank you very much, Mrs. Riopelle. Bye-bye.
Bye.